Hi, this is Dr. Shazad again, and today I bring for you about how to write a personal statement. Personal statement is your face value. When you send it to the programs, uh, they look initially two things. One is your resume, and the second thing is your personal statement. And the first two big paragraph of your personal statement is enough to give a program an idea that who you are and how you're going to fit in their program. So um, I'm going to mention certain points which may help you to write your personal statement and may help you to get into the residency program. This will be a two-part video because I can't cover everything today, but I will try my best. So first thing is start from the introduction. A very brief introduction we have to do because we don't want to miss those things which are important. Introduction is like a generalized thing. You introduce yourself already when you are in your resume and as a candidate, but personal statement is a personal statement, so be brief in an introduction of yourself. And also, what do you want to be specific about the program you're applying for? For example, you're applying for an intern medicine, you have to also write a couple of lines starting saying that I am interested in intern medicine. You can change some wordings which can basically a click point for you. And the second thing you can mention in your personal statement, what motivates you to go to in medicine and spend if you are in a if you are a foreign grad, spend 5 years in a medical school or 4 years in a medical school, and then why are you so passionate about the field of position you are applying for? And you can also briefly experience your personal stories, which is a very important, because if you have one, you don't have to drag about it. If you don't have one, that's okay, you can skip it. You can make something else for motivation. There's always motivation behind everything. For example, you love to come America and you want to be trained in American system because you love American system in this way, that way, whatever you have in your mind, and be truthful. If you be truthful, you won't be confused, or you won't be like jittery in your interview. It will be reflecting from your personal statement. So be very honest about your motivation. You don't have to make up any stories, okay? Basically, sometimes personal stories are the experiences also. For example, you can say, my when I was in my internship or my first job in back home, I came across a lot of patients, and then you can also mention one of the patient experience. It doesn't have to be your family experience, doesn't have to be your personal experience. So you can also learn from the patient of your own, which you had in the past. And also, in a relevant experience, you can write academic backgrounds and your achievements. Like, for example, you were third position holder or second position holder, you always did, you were a motivational speaker, or you were whatever your achievements are, and which is relevant to the personal statement or relevant that position. I think you should briefly mention this. That can show that if they offer you any position, you are basically going to inspire many other your colleagues, and you will not be a dull personality resident, or you will not be a isolated resident. So your life is full of experience which you're not afraid to explain, I'm sorry, to mention or to share with your colleagues. Show your research work. That's definitely you should show, and whatever you have done, you should mention that. That's very important. It will show also on your resume, but be very brief that you particularly your interest in the research. Like for example, if you had an endocrine field in the past, you were interested and you have wrote a lot of papers, and you briefly can mention that your for example, your interest was in familial diseases of endocrinology, and you were always interested to know the genetics, the inheritance, and autosomal recessive disorders. So that can also move things along. Also, you can mention your volunteer work wherever you have done it, which is also very important, and your skills. Your skills, meaning it doesn't mean that you were good in IV lines or you were good in a, it doesn't have to be your medical skills. It has to be your personal, personal interactions, or your personal interactions with your colleagues, with your friends, or with your, any interaction. You can mention which interests you, and it's easy to explain that during the interview, because that's what the program director look for. They read your personal statement, and they wanted to know if this person I'm hiring, what he wrote is actually right, and he is the person who I'm going to hire has written what he is. So I think that's very, very important. And also you can also continue that skills or your experience, or and you can little bit explain it in your personal statement. I think that going to help you and help other person, either is a program director reading it or the faculty, that how do you feel about that experience. So we're going to finish today on that part. So basically I'm going to go over the headlines. First is the introduction, very important, brief and strong, and what motivates you to apply these programs and be a doctor or be an intermedicine physician. Motivation has to be there. You have to show it in a brief sentence, so that reflect you, and your relevant experiences, either is academic or is out of academics or extra academic, that shows your personality actually, and this is very important. And you have to be very careful when you write that. And skills and qualities, of course, those are the most important things also to mention in a briefly matter, and so somebody can understand and choose you as in their program. Thank you, and see you again.